just click the link that says get a custom NCLEX study plan. All right. So again, we are doing maternity and peds. Let's jump into it, guys. And if anybody jumps in and you have some wins to share, I will stop for a win. Okay. Because I love shouting out the dubs. All right. Sandy, I think, how do you repost? I think there's a little, there should be a little arrow. There should be a little arrow down here in the corner. All right. So there you go. Thank you guys so much for sharing the live. All right. So these questions have quite a bit of detail in them. All right. So the first few I feel like should be pretty relatively straightforward. Thank you guys for reposting. Yeah, I love you guys. All right. So let's make this a little smaller. Okay. All right. So there we go. Can everybody see that okay? Somebody. Okay. All right. Fantastic. So we got a lot of detail here. All right. Don't let it trip you up. All right. Some of these questions on the exam, you are going to see a lot of detail, and a lot of it can just be nonsense. All right. So you got to weed through and decide what is important here. Okay. So again, today's topic, maternity and peds. Maternity. All right. Afra says, perfect. We're studying peds and maternity right now. Let's go, Afra. Let's go. All right. Yep, we won't waste too much time here, guys. So yes, absolutely. The answer is B. All right, we are gonna discontinue that oxy, reposition the client, and initiate an IV fluid bolus, right? Because late D cells with minimal variability in the setting of like uterine tachysystole, okay, and they got that supine hypotension, point to some sort of placental insufficiency, right? Then there's also the decreased fetal oxygenation. So the fastest way to remove that is by stopping the oxytocin, all right, while improving perfusion, all right, with that lateral positioning and fluids, all right? So good job. That one, there's a lot of detail there, but I feel more or less it was kind of a gimme. Okay, so good job. Here we go. All right, guys, let's see. Let's see what you got here. All right. Okay. I'm seeing a lot of B. A lot of B so far. All right. Nothing else? Nothing else, guys? Nope, you're right. It's B. It's definitely B. Okay. Because we're talking about the high boggy uterus, right? Heavy lochia is pointing to signs of that uterine atony. Okay. And a distended bladder is going to prevent effective uterine contraction and uterine clamping. All right. So the fundal massage is going to be that immediate intervention. And then emptying the bladder treats the reversible contributor there while the hemorrhage steps are initiated, okay, without delay. So that is it. You guys nailed it. Let's not waste much time. I don't think anybody got that wrong. Okay. Let's talk about preeclampsia here. Let's talk about preeclampsia. Okay. I'm seeing some A and B. Okay. What's that mnemonic that you guys have been saying? Oxytocin is for push. Mag is for what? What do we got? Come on. Yep, you guys are saying A, but what's the what? You guys picking up what I'm laying down? Oxytocin is to push, as mag is to mush, right? Okay, so too much mag toxicity turns your patient into mush. Everything slows down. All those reflexes go away. All right, there's respiratory depression, increasing somnolence. All right, these are decreased urine output. Everything slows down. All right, your patient turns to mush. So if all of those things are happening, you need to stop the magnesium infusion. Okay? Prepare the calcium. Prepare the calcium glutamate. All right. Yes, Lauren, now you've heard it and will remember forever. All right. Good job, guys. Good freaking job. Let's talk some peds here. All right, June, thanks for sharing the live. Absolutely. Emmy says, I'll be taking the exam with the image of your lips and sound. Yes. As gross and unattractive as that was, you remember that. Let that live rent-free in your brain every time you see magnesium sulfate hanging at someone's bedside. Marion, there's one. Passed my NCLEX today at 85 questions. Thank you so much for your help, she says. Everyone, drop some love for Marion in the chat. All right. Drop a dub for Marion. Amazing. Hell yeah, there it is. There's all that Nurse Jimmy community love. Hell yeah. Love it, Marion. Marion, send me a DM too. I'd love to chat more with you. Okay, so. Let's see. So we need to select all that apply here, guys. All right, so we have a newborn that's barely an hour old. Which findings require immediate RN action? All right, the correct answers here are going to be A. All right. The answers are A, B, and C. Okay, now bear with me. I'll tell you why. Okay, so a glucose of 38 in a symptomatic newborn is hypoglycemia requiring prompt intervention. Okay, that's going to be either feeding and or whatever your protocol escalation is, because newborns should generally be maintained above 40 milligrams per deciliter. Okay, and symptoms there are going to increase the urgency. Hypothermia, okay, 36.2 degrees Celsius. All right, increases oxygen and glucose consumption and is going to worsen the hypoglycemia risk. So warming is therapeutic and urgent, okay? Retractions at rest indicate increased work of breathing, okay, and possible respiratory distress that can decompensate quickly, okay? So for D, D's going to be incorrect because periodic breathing with brief pauses under 10 seconds can actually be normal, be a normal transition pattern in newborns when self-resolving without color change or bradycardia, okay? For those of you who put E, that's also going to be incorrect. An SpO2 of 92% at about 1 hour of life can still be within expected oxygenation standards, okay? It warrants monitoring, but it doesn't really correlate with the work of breathing right now. Okay. Does that make sense, guys? All right, so A, B, and C. All right. Let's move along. Did we do 5? Here we go. Question 5. All right. All right. Good job, guys. Yep. This is definitely going to be A. We're going to keep them calm. All right. Activate the airway team while preparing for intubation, right? Because they're drooling. They have tripod positioning going on. So we are, exactly, anesthesia. We are suspecting that there's epiglottitis at work here. And so we're not going to do anything. We're going to escalate that immediately. Prepare for intubation. We're not going to put anything in their mouth. All right. So, good job. I don't think anybody got that wrong. Good on you. Let's jump. Holy shit. Anastasia says my dad died of that? Holy moly. So sorry. All right. All right, thank you guys for sharing the live. Much appreciated. If you guys haven't, I would greatly appreciate it if you would consider sharing the live. You can do it down there in the corner to get a few more people in here. And if you're new to my lives, I do these every Sunday, Tuesday, Thursday at 9 p.m. Eastern Standard. All right, and you could follow up there if you're not already following. All right, so we are on question 6. And yes, you guys are correct. Those of you that are answering A is going to be correct. Okay, so the reason why multiple over-the-counter products can contain Tylenol, acetaminophen, right? And uncertain dosing plus decreased wet diapers and unusual somnolence raises that concern for there's some sort of toxicity and dehydration. All right, so the priority is going to be rapid exposure assessment to determine the need for emergent evaluation and any sort of antidote planning. Call poison control. Escalation is going to be time sensitive, especially when you think that an overdose is possible. All right, good job, guys. Good job. 7. All right, postpartum nurse. All right. Does anybody know the name of this medication? What is the name of this shot? Anybody know? The answer is, in fact, yep, there you go. Paris got it. Rogam. Good job, guys. Yep, the answer here is going to be A is correct. So the Rogam shot is going to be indicated postpartum when an Rh negative mom delivers an Rh positive newborn to prevent sensitization from fetal maternal hemorrhage at delivery. All right. So if a mom screens positive on the antibody screen, they can reflect passive anti-D from prophylaxis rather than any true sensitization. All right. Yeah, Rogam is a funny shot. There's a few things that go into it. It's considered it's essentially considered like a blood product, right? And I believe I normally need to get it from the blood bank, or it gets sent to me. Somebody gets it. All right. I've given it a handful of times. Thank you guys for sharing the live, and following. So thank you guys for getting in there. Thank you guys for following. If you guys haven't, we do these lives again every Sunday, Tuesday, Thursday. Although, let me just say, I am traveling this week. I am doing some instructor training. I am learning how to become an instructor for our hospital systems, how to de-escalate situations with crazy patients, and how to keep yourself safe and keep your other employees safe. So I'm going to be learning how to do that, and so I'll bring share a little bit of knowledge to you guys. And however, I'm going to be traveling back from there on Thursday. So I'm actually going to be moving Thursday's live to Friday. Okay. So I'm going to be moving Thursday's live to Friday. I'll make a couple more announcements, so don't worry. Barrett, I'm just trying to get my my phone to charge here. One sec, guys, coming right back. Okay. All right. Yep, still good for Tuesday. Still good for Tuesday. Guess what Tuesday is, actually? I'm not usually one to boast this all, but Tuesday's my birthday. But I'm also going to be traveling, and I'm going to be by myself in a hotel room. So, hey, why not spend it with you guys? Right? All right. I'm here for it. Tuesday, I'll be sharing my birthday with you guys right here, doing some question strategies. All right? Hell yeah, let's do it. All right, so no, not that question. All right, let's bring these down. We already did 6. Thank you guys for all the happy birthdays. All right, here we go. Maybe doing the Lord's work. That's right. That's right. All right, what do you guys think here? Take a look at this. Let me know. Why does not charge? No way, Gracie. Tomorrow's your birthday? Get out of town. Capricorns, what's up? My wife is also a Capricorn. We had a whole conversation today about if we're really compatible as two Capricorns. Turns out we are. Her birthday was a week or so ago. Nothing is charging right now, which is annoying. All right, so what do we think the answer here is, guys? We're seeing a bunch of A, C, and D, B, C, and D. All right, the answer is, in fact, A, B, C, and D. So 4 of them here. All right, so let's talk about it. So frequent swallowing and throat clearing after tonsillectomy can indicate bleeding, all right, as that blood kind of trickles down the throat. Bright red blood suggests active hemorrhage, all right, and coffee ground emesis indicates digested blood. Both require urgent intervention. All right, then tachycardia without fever can be an early sign of volume loss in children who may compensate, right, until suddenly decompensate. All right, so A, B, C, and D. All right, let's pop question 10 up there, guys. All right, check it out. Let me know. Something should be going on here. That outlet just doesn't want to work as intended. That's okay. All right. So, question 10. Yep, the answer here is going to be A, guys. All right, perform a focused neurological assessment. So a positional headache here that improves when lying flat after a difficult epidural is going to be highly suggestive of a post-dural puncture headache from cerebral spinal fluid leak. Okay, and early anesthesia involvement is key here to definitive management. Okay, usually it might require some sort of epidural blood patch. All right, so you need a focused neuro exam. BP reassessment is going to be appropriate to screen for alternate postpartum emergencies then while implementing supportive measures that match the most likely diagnosis. Okay. Very, very good there. All right, let's pop up number 11. Number 11. All right, thank you guys for the follows. Much appreciated. All right, so question 11. Answer here is going to be B. I think all of you got it. Elevate the head of the bed, apply oxygen, remain with the client. Okay, so here we are going to intervene. This is an unstable patient. Right, so the priority is going to be immediate stabilization and escalation because that sudden hypoxemia and tachycardia after the C-section suggests that there's some sort of PE, maybe amniotic fluid, embolic physiology, right, until proven otherwise. All right, so good job. I think pretty much everybody got that. 12. Let's go. All right. So, what are we doing here, guys? We are going to be doing B. We are intervening again with this patient. All right. Inspect the perineum, maintain the client in a supine position, notify the provider. Okay. So here we're talking about unilateral perineal swelling with escalating pain plus AF tachycardia and hypotension. All right. That's going to suggest some sort of hematoma with some concealed bleeding that could probably progress rapidly, even though it looks like normal looking lochia right now. All right, L, thanks for the follow. Appreciate you guys. Here we are intervening first. We know the problem is obvious and dangerous. All right, we are intervening. We do not need to assess further. All right, we do not need any other objective information at this time. Okay. So we are intervening here. All right, so I'm going to put up question 13. All right, and for those of you who might be new to this, to the formula here, I want you guys to tell me for question 13, are we assessing, intervening, evaluating, or teaching? All right, well, let me know in the chat. Read the question, and before you read the answers, let me know in the chat. What are we doing? All right, thank you guys. For those of you joining, we're doing as many questions as NCLEX questions as we can get through in 60 minutes. We're going to 10 p.m. All right, let me know now. Look at that question. Are we assessing, intervening, evaluating, or teaching this patient? All right. If we are evaluating, we would need to have done something in the chat. Well, you're right. We did do something here, but the child is quieter, sits still, answers in short phrases. All right. Which action is the nurse's priority? So here, though, the child is still unstable. So we need to intervene. We need to intervene here. So which answer is an intervention? Which answer is going to be there's a couple interventions there, but what sign is the correct one? All right. And I'm seeing some A's. Yes, guys. Yes, absolutely. It's going to be A. All right. So a quote, quiet chest with ongoing hypoxemia and tachypnea after treatment is a late and bad sign of poor air movement and impending failure. All right, so definitely A is going to be our answer there. Let's go to 14. Let's talk about this 2-day-old newborn. All right. Which orders should the nurse anticipate being implemented urgently? Select all that apply. That's right. Yeah, Claudia, quiet chest is bad. Very bad. All right. Select all that apply here, guys. This is multiple answers here. For all these select all that applies, you should read the question and then decide, is it true or false? If it's not true 100% of the time, then throw it out. All right? Yep. All right. Good job, guys. So some of you got it. Let's see. What are the, come on, drop your answers in. It is A, B, and D. That's right. So A, B, and D. We need to intervene. Okay. what we're seeing here suggests that there's neonatal sepsis, okay, poor perfusion. So blood cultures with antibiotics and hemodynamics, okay, are going to be very important and time sensitive. Okay, so absolutely. So it's A, B, and D. C is going to be incorrect. Waiting for CBC delays antibiotics, right? And this is a high risk symptomatic newborn, so we're not going to do that. And for E, temperature control matters, okay? But an open crib is not appropriate for an unstable newborn with perfusion and respiratory concerns. All right, so that's why that one's not it. Let's jump to 15. All right. Let's jump to 15 here. Ms. Brown, thanks for sharing the live. Greatly appreciate that. Thank you guys for the follows as well. We do these lives every Sunday, Tuesday, Thursday at 9 p.m. Eastern. However, this week, Thursday's live will be on Friday. All right, because if you're just joining, I will be traveling this week. All right. 15. I'm seeing some A and Bs. All right. Good. The correct answer here is going to be A. All right, calling for additional help. We need to intervene. Okay, we need to intervene. Shoulder dystocia is an emergency, okay, where immediate team mobilization and first line maneuvers like the McRoberts reduce time to delivery and hypoxic risk. Okay, McRoberts maneuver, that's one where the woman's laying on her back and she brings her knees to her chest as tightly as possible. All right, that is McRoberts maneuver. Some of you said B, it's not going to be B. Okay, suprapubic pressure can help, but telling the client to push harder is going to increase impaction, and it's going to delay first line sequencing here. Okay, so there you have it. Let's jump to 16. There you go, Lauren. That's right. Learning something new. Love it. Thanks for being here. Let me square up. Get my legs straight. All right. What are we thinking, guys? Let's see some answers in the chat. All right, so a nurse is caring for a 6-month-old with bronchiolitis who had poor oral intake. The infant is tachypnic with nasal flaring but is still alert and intermittently smiling. Caregiver says he spits up everything I give him. The nurse notes dry mucous membranes, a sunken anterior fontanelle, and fewer wet diapers. Current vitals are that. Which action is most appropriate? All right, so we have kind of a sick kid here, right? And it looks like the majority of you are between A and B. So let's break it down here. The correct answer is, in fact, going to be A. All right, so if you got A, let me get a thumbs up in the chat. All right, give yourself a thumbs up in the chat, because here we need to intervene in the sense that dehydration is present, but the current tachypnea and poor coordination of that suck, swallow, breathing make IV rehydration safer until work of breathing improves. Okay? Do we get that? All right, so due to the tachypnea, the IV rehydration is going to be safer. Okay, so good job. Look at all those thumbs up. Hell yeah, love to see it. Love to see it. Let's go. Let's jump into number 17 here, guys. Well, I guess, yeah. Some of you said B on that last one. Feeding during significant tachypnea increases aspiration risk. So that's why B was not correct. Okay. Let's go. Okay. What are we thinking? We're seeing a few answers. A few of you are saying C. Okay. Which prescription should the nurse question? All right. And so you read that question. Are we assessing, intervening, evaluating? Are we assessing, intervening, evaluating, or teaching? Which of the 4 roles are we taking on after reading this question? Are we intervening, assessing, evaluating, or teaching? So we intervene when there's an unstable patient. Okay. Is this child unstable? Okay. It says it in the chest. It says it in the question. It says a rapid trip is positive and the child is otherwise stable. Okay. So no, we do not need to intervene in this question. Okay. But we are missing some more data, some objective data. So we need to assess. All right. And so the answer is C. All right, the answer is going to be C. The nurse must clarify the allergy history before giving a penicillin class medication. So, yeah, with a reported penicillin allergy, anything administering penicillin without verification is going to be unsafe. So the answer here is going to be C. Okay, the patient is stable. All right, they're not unstable. It says that they're stable in the question. All right, so just make sure you're seeing that when you read these. All right, because if you go in thinking that this patient's unstable and like, oh my God, I need to intervene, you're set up for failure here. Okay, so we intervene usually when the patient is unstable. All right, we teach only boring or very, very stable patients. Okay, and then for evaluating, something needs to be done in the question. You know, hey, I gave 4 milligrams of morphine to a patient in severe pain. Which action by the nurse is most appropriate? Well, probably going to evaluate that pain level now. All right. So for that one, it was 17, right? Yep. So the answer is C there. Okay. All right, let's look at 18. Let's look at 18, guys. Okay. All right, what are we doing here? Jennifer says B. Do you guys agree? Do we agree with Jennifer? Tina says, hell no, I don't. Hell no. Alejita says A as well. No. Oh, lots of A's here. All right, so we are between A and B. And guys, Jennifer says, I'm standing on B for business. Standing on B for business. And she is right. The correct answer here is going to be B. Jennifer, clock it in the chat. Clock it in the chat, Jennifer, and everybody else who put B. All right. So here we are intervening. All right. Fever, right? Because that was in the question, 101.8. All right. So fever, uterine tenderness, and cramping, and it's getting worse. Foul-smelling lochia. Okay, those are concerning for postpartum uterine infection, which requires prompt in-person evaluation and treatment. All right, so yeah, taking Tylenol on the way, perfectly appropriate there. All right, for A, for those of you who put A, avoiding antipyretics is not necessary. All right, and can worsen discomfort without improving any sort of diagnostic safety. Okay, so B is the most correct answer there. All right, good job. Good. All right, guys, we got about 15 minutes left. Let's see how many more we can get through. All right, let's do it. Let's see. Look at all those folks clocking it in the chat. Again, guys, if you're not already following, highly encourage it. All right, we do these lives 3 times a week, Sunday, Tuesday, Thursday. Although this week, that Thursday one will be on Friday because I'm traveling. So go ahead and follow if you're not already following now. All right. And if you're studying for the NCLEX or getting ready to study for the NCLEX, I do custom NCLEX study plans. All right. If you are interested potentially in a custom NCLEX study plan, let me know in the chat. All right. Let me know. Drop a me in the chat. Okay. Okay. Tia, you should have received yours. I don't have any pending right now. So DM me, Tia, and so we can look through. But I have sent out all the ones that were in my inbox. All right. All right. Yeah, guys, if you guys are hearing me, if you're interested in the custom NCLEX study plan, go to my profile page right here. All right, go to the link in my bio and select get a custom NCLEX study plan. All right, they are $25. All right, that's just definitely, it's definitely worth it, and it gives you a strategy and a plan on how to study for the NCLEX. All right, based on resources you already have. Okay. All right, guys, let's look at 19. The answer here for 19 is A, C, and E. Okay, we need to intervene with this patient, right? All right, so symptomatic bradycardia and hypotension after a high-risk ingestion is going to require immediate monitoring and hemodynamic support with rapid escalation readiness. All right, so B is going to be incorrect here because charcoal can be considered early, but in a sleepy child with instability, it's not the immediate priority and actually will increase aspiration risk. Okay, so that is why B is not going to be appropriate here. Okay. Persian honey, you got this. You have your final tomorrow. What class is it? What class is it? The answer for 20 is A. I'm sorry. 19 is A, C, and E. This one is A, C, and E. And I accidentally just gave you the answer for 20, so I'm going to skip 21. All right, let's do it. 21. T and Nicole, thank you. Awesome. I'm glad you found the plan. I'm sorry that you didn't see it, but I knew I sent it out. All right. All right. All right, where are we at? 21. All right. Old G1P0 at 40 weeks for receiving oxytocin. Are we intervening? Are we assessing, evaluating, or teaching? What are we doing, people? We are going to be, Afra says intervening, Claudia says intervening, and you guys would be correct. We will definitely be intervening. All right, and the answer is in fact A. All right, because this requires immediate correction of the tachysystole and hypotension-driven uteroplacental insufficiency. Okay, and you do that by removing the trigger and restoring perfusion. All right, so we need to stop that oxytocin, turn her on her side, and then start that fluid bolus. Okay? Good job, guys. You guys are getting this. All right? And if you're not getting them correct, that's okay too, just as long as you're learning. If you're learning, that's perfect. That's all we need. All right? That's all you need. Just be improving a little tiny bit every single day. All right, and that's what the custom study plan does for you as well. All right, so again, after this, after the questions are done, check out the link in my bio. Go to get a custom NCLEX study plan, and let's knock this thing out. Let's get you across the finish line. All right. All right. So we have a postpartum nurse. I'm seeing A and C. I'm seeing lots of A's and C's. All right. Anybody else? You guys are all about the A and C. It's so cold in this chat because the AC is crazy. Y'all got the AC turned up. It's late, y'all. I've been up real early. My daughter had a volleyball tournament this morning, so you are getting a very just drawn out version of me right now. Oh my goodness, I've been up since 5 a.m. All right. Okay, let's rock and roll. Guys, the answer here is going to be A. All right, but I love to see all the laughing smiley faces in the chat because I'm a words of affirmation person, and so I like that feedback. Lauren says club volleyball actually sucks for that reason alone. Yeah, but my daughter loves it, and I love her, and I love being there. It makes me happy to see her play. And they did really well today. So I'll wake up at 3 a.m. if it means that I get to see her do something she loves. All right. So answer 22 is A, massage that uterus. Okay. You need to massage the uterus while arranging bladder emptying and then reassess tone and bleeding before adding medications. Okay, So we are intervening with this answer, right? So you should have read the question and be like, I need to intervene, right? So A is an intervention here. It is the most appropriate intervention, and we're doing this because immediate mechanical correction is needed. Okay, so we're talking about uterine massage and relieving the bladder distension. Okay, it is the absolute fastest way to reverse atony-related bleeding. Okay, for B, B is going to delay the quickest cause-directed actions. C, the catheterization alone may not restore tone quickly enough without simultaneous massage. All right, so that is why C is not going to be the answer here. So you guys are between A and C. All right, that's why C's wrong and why A is more appropriate. Does that make sense? Kate is like, can you please emphasize more on the answer? Yes. There you go. Mrs. Dugas, thank you for the follow, guys. If you guys aren't already following, I would highly encourage you to follow. Lots and lots and lots of NCLEX content on the page. Full 32-part playlist on the page, as well as these lives 3 times a week. All right, so let's jump into 23 here. We got time for a couple more questions. All right. All right. What are we thinking here, guys? What are we thinking? Okay. Everybody's jumping on the A train. A train's about to leave the station because you guys are correct. All right, absolutely. So we need to establish IV access and begin weight-based isotonic bolus while initiating the sepsis workup. So yes, this is shock physiology. It's going to require immediate perfusion support while rapidly triggering time-sensitive sepsis evaluation. Okay, good friggin' job. Let's see if we can get another one in here. 24. Let's skip ahead a little bit. Let's skip ahead. Let's see what 35 looks like. Let's see what 35 looks like here. I just picked one. I wanted to get to some of these. I think some of these in the back of my stack are a little more challenging, but we'll see. Maybe not. You guys are so smart. You'd be like, oh, Jimmy, this is so easy. These are like NCLEX questions for 7-year-olds. Okay. I'm seeing some A and B. All right. And the answer is A. Yep, we're going to intervene here. We are going to intervene. We need to put in oxygen, obtain IV access, and prepare for rapid transfusion. All right, here, let's do another one. Where else I got? Let's jump to, let's see what 38's about. Let's see what 38's about. This one's kind of easy too. Well, that's okay. Good job, guys. Good job. All right, and after this question, stay put here, okay? Especially you guys, if I call you Celine, Afra, L, if you guys are still here, All right. I'm going to try to tag you. All right. If you guys are still here, stay put. All right. As well as anybody else that might be interested in a custom NCLEX study plan. All right. So for 38, the answer is going to be A. Yes, we are talking about postpartum psychosis. So we need to complete an immediate safety assessment. All right. Why? So this is an assessment question. We need to assess further. We do not have all of the information necessarily required. So we're going to complete that assessment, right? Hallucinations, disorganized behavior, postpartum are psychiatric emergencies and they require immediate safety eval. All right. So, yes, absolutely, guys. I don't think anybody asked or put any other answers down there. So you guys knocked it out of the park. So, boom. That's what I'm talking about, guys. That's what I'm freaking talking about. Good job. All right. Let's see here. Good job. Good freaking job, guys. So proud of you. Let's go back here. All right. So this week, yes, lives are going to be Tuesday moving forward. So this week is going to be Tuesday and Friday because I'm traveling. All right. That's okay. All right. So you guys are welcome. Absolutely. I'm here for it. Persian honey, I'm sorry. I'm really trying to get these lives up, posted over on YT, right, under Nurse Jimmy Official. I'm very behind on getting them up, so I apologize. But I'm working on it. There's quite a few up there for you to watch if you haven't already checked it out. All right, let me talk real briefly. There's 120 of you in here. If you guys are interested in a custom NCLEX study plan, drop a me in the chat right now. All right, this is your opportunity here. Drop a me in the chat because I will create you a custom NCLEX study plan based on your resources, your life, the amount of time that you have to study. Okay, yeah, 2 days is a little tight of a window. Okay, all right, 100K, baby. Okay, perfect. Stay here. Pandy Adorable, stay here. Theodore, stay here. All right, I'm about to show you how to go about it, okay, and basically what it is, okay? So, right here, we're going to turn this camera around. All right, this is my profile, right? You're going to go to this link right here, okay? And it's going to take you here, all right, to this page. And from here, you are just going to select get a custom NCLEX study plan. Okay, simple as that. Then it's going to take you here. And this is the information that we need to make this as custom as possible. So some basic stuff, tell me which NCLEX you're taking. Is this your first time? If it is, great. I do this for first-time test takers as well. If it's not, click no. And then I'm going to ask some questions about your CPR. All right, what sections were you above the passing standard and which were you below? What your test date is. What resources you currently already have access to. All right, what topics do you feel you're already struggling with? All right, and I'll help weave those into your study plan. Okay, how much study time do you have available on the weekday versus the weekend? So I'm looking for I've got 6 hours a day each weekday, 4 hours a day each weekend day. Okay, and then what days of the week are you available to study? If you're available all of them, select all of them. I'll even manage it and put it in your plan to manage your test anxiety and give you some strategies on that. And then finally, any other information that might be helpful. Please be as specific as possible. Anything about your learning style, your support system that you have at home, if you have one, if you don't, if you're a single parent, whatever the case may be, I will tailor this plan to you. Okay? So that is that. And then you pay at the bottom. Okay. It's $25. All right. So there's that. That's the custom study plan. The NCLEX Vault is also here. All right. And what that is, it is about 230 pages of cheat sheets on every subject, that the NCLEX covers, as well as a strategy section. Okay, so just need your full name, email, access now, and it'll pop up. All right, so that's what we got going on. All right, any other final questions here before we jump off? All right, I'll turn this around real quick, show you the vault, what's basically there. Okay, guys, look. So there's on the side here, when you open this in the desktop, you can open it on a phone. It's fine too. The cheat sheets are free, Claudia. The cheat sheets are free. It just your name and email. Click access now. It opens here. Okay. So fundamentals, maternity. So we just did maternity. Okay. Here is a whole just very straight to the point. Okay. Remember, I said this on the live. Pitocin is push. Mag is mush. Okay. What are the signs of your magnesium toxicity? Okay. Preeclampsia, eclampsia. And then look at the end of each section. There's a little mini quiz. 25 questions of increasing difficulty. Okay. Just to test your comprehension there. All right, and all that. Do not miss or overlook the strategy corner here either, guys. All right, this is specific. Yeah, Claudia, the cheat sheets are free. Okay, the $25 is for the custom NCLEX study plan. They're two different things, two totally different things. Okay, so the study plan is the thing that I make to you. This cheat sheet with all of this material here is free. Okay, so the NCLEX there, so it talks about the NCLEX, the strategy that I created to help you answer any single question on the NCLEX, the action framework. All right, it can be applied to every single question. We talked about knowing your role with these standard multiple choice questions. Right? You have to decide the role before reading the answers. All right. If you have an unstable patient, that means no teaching ever. Okay. You either assess or intervene. You remember that from the live? Okay. So all of that stuff is there. Some tips on SATAs, case studies, bow ties. All right. Drop down questions. So there's a bunch of strategy stuff there, and then all of these topics are there as well. All right. How long does it take to get the study plan, and does the study plan have questions or a learning guide? So the study plan you will get back in 24 to 48 hours. All right. The study plan itself does not contain questions, but rather it references any subscriptions that you already have in place. Okay. So over here in the intake form, I ask, what subscriptions do you already have access to? Okay. So here's where you'll click, I've got Archer or Bootcamp or UWorld. Okay. And so these are your question banks. All right. So in the study plan, when I reference, hey, do a mixed set of 75 questions, I'm going to reference whichever one of these you select, okay? Because I know probably 95% of you have these paid resources, or at least one of them, Okay. So that's what we're referring to. And I just made a plan the other day for somebody with no resources, and we leveraged some free question banks. All right. It may not be as reliable, but it's definitely doable. Definitely doable. There are free resources for question banks. Okay. So that's that. So, all right, guys. So there you have it. I'm going to flip this back around. Getting ready to sign off here so I can go to bed. I hope that was beneficial, and look forward to seeing you guys in the future. In a future live here, we'll do another one on Tuesday where we will do some question strategy. All right. So, Emmy, we'll see you later. Everyone else that's in here, 100K, baby. Definitely check out the study plan. All right. Claudia, check out the study plan and DM me if you have any questions. All right. I am there. Yep. Strategies, my B-Day. Wait, Emmy, did you say your B-Day is the 13th? Oh, yeah. Yeah. My B-Day. That's right. I was going to say, do we have the same birthday? All right. Yep. Absolutely. I will see you on Tuesday, my birthday, hanging out with you guys. All right, guys. Until then, talk to you soon. Boop. Later.